Dr. Ted Wymyslo, the director of the Ohio Department of Health, holds a unique position in state government because he's a family physician who has been futuristic in his use of electronic health records and new communications technologies with patients in his own practice. Listen as he gives a pragmatic perspective on how electronic health records are better for his practice, for his patients, and for the practice of medicine.
The really benefit of going electronic was for my patients, I think, more than I saw it. My patients really experienced it because they got to see in a comprehensive manner what I knew about them at any given point because I shared it with them with our patient portals. So I connected my patients to their record electronically, and they took their information home, anywhere they traveled. They were always connected to their information base, which means they were an informed consumer. They were always informed of what was going on with their own health. They didn't have to call me for things that usually patients would have to, like shot records or medications to get them straight, because they had access to all that information themselves. And anytime they went anywhere, like emergency room or to another doctor, they could bring their record up electronically and show them where they were at any given time. But an even better part of this was now I had a better comprehensive view of what my patient's health was at any given time. Before that, I had to fumble through charts and look for things and try to find them. And then since I had partners, it was kind of nice because if anyone saw my patient in my practice, they could open up my record and find anything they wanted at any time about my patient without me being there. And on call with our VPN access, they could get through their computers at home, or if we're traveling, I could get into it myself. I could get into any patient's record I needed to answer questions that might come up on call, or if I'm traveling, if I wanted to respond perhaps to questions that came up, I could electronically get into the record anywhere in the world. So it really opens up access to information in a way that I never had access to information before I went electronic.
Did you have alerts on yours where it would talk about, they have where if you're allergic to a medication,
Oh, sure.
if you need a certain test?
Yeah. Drug-drug interactions were very easy to get at. So almost every time I prescribed something, it would tell me what I should be considering, not only about what other drug interactions there might be, but also now you can tell, is that drug one of the preferred drugs on the formulary? What's it going to cost the patient? So it's kind of nice because as we're prescribing, we can make sure we take into account the affordability of what I'm giving a patient as far as a recommendation. And if I've got 4 choices, and they're all pretty much the same as far as outcomes go, then I can pick the most affordable one for the patient. Well, that enhances the chance that the patient will actually do what I recommended that they would do, and so our adherence rates go way up with that, which means I achieve my outcome goals that I have, like for blood pressure control or heart failure control or diabetes control. So then that makes my whole practice as a whole look better because I'm hitting my quality parameters that I'm trying to achieve. Well, that helps distinguish me from other docs, right? And it also helps me to compete against myself at all times to try to continually get better than I was before by focusing on the areas where maybe I'm not hitting quality standards that we've got set nationally. And then I know where my problems are in my practice because now I can look at my whole population of patients and tell where I am at any given time with all these people that I'm managing. With the electronic record that's got a registry built in, I'll know what's happening with every single diabetic patient in my whole practice. No, there's nowhere to hide with it. We can get that information, and so I'll have a much more accurate idea of how good a job I'm doing. Also have a more accurate idea of where my needs are in my patient population. And then if you have actionable registries, what they do is actually connect with patients who are overdue for things or are supposed to be given alerts or we're supposed to give reminders to. See, it can just do that automatically. It doesn't give me a report. It just, the actionable registry automatically connects with the patient and does what I've already programmed into my system to do. Now, it's also challenging because it's a different way of working. Your everyday work changes dramatically when you're working off of electronics. So building in email communications to patients through their record is different than what I'd done before. Getting used to looking at my in-basket to see the reports coming in electronically, that was different for me also. Then communicating with external parties and maybe sending off to them digitized x-rays and other things, That's very different than anything I did before. So I had to change my workflow pattern and then train my staff to help me with some of that, so they could actually help intervene in some of the situations I was facing in a way that helped to extend me a bit. There's a million things in our old paper system that would keep people busy, and one of the biggest was finding the record, right? So if you lost a medical record, a paper chart, that could take a lot of time to find it, a lot of wasted manpower, very frustrating and dangerous to patients. Because you can imagine if someone's on the phone, like a pharmacist asking me a question, and I need that chart, and it's not available to me, that could even be a problem with safety. So safety is built into the system, because at a glance I can tell all the medicines a patient's on. If other people prescribe, we load that information in, and we can tell right away if there's going to be a duplication or perhaps an adverse effect or a drug interaction that's dangerous. It's a little more readily available to you, that information, if I can just pop on my computer and get into their record. This makes information much more immediately available to me. It's immediately available to my patients also through patient portals. And well, I think that's one of the godsends of electronics, is when a lot of my patients travel. So the nice thing is as they're traveling, they can go ahead and communicate with me electronically. So it's asynchronous communication. They can email me through their record. Question comes in, and I bring it up through their record so I can look up the answers to their questions in their record, email it back to them, and that response is embedded in their chart forever. But the beauty is the patient doesn't have to wait till they get back to town or call me long distance or do other things. All they do is send me a quick email, and I can respond between patients to their questions. That saves them time, it saves them trouble, and it helps them make better decisions. Because a lot of times their question is, should I go to an urgent care center? Should I go to the emergency room with this? Should I up my dose? What do you want me to do? I'm down here for 2 more weeks. And I can give them great advice. And so this does a couple things. First, it's safe for them, so because people have all their information available to me and anyone they're seeing. But it's also cost effective, right? Because many times, I'll bet 95% of the times, I handle electronically the questions that come up. If I wasn't there doing that, these people go to ERs or they would go to urgent care centers. So what I can do is save a patient, an average of $500 to $700 for an ER visit by staying connected with them electronically. Well, if everyone in the country has that, now you're talking hundreds of millions of dollars that you're saving a year by connecting people with someone who knows them, who's got access to all their information.
Thank you to Dr. Wymyslo for sharing these practical thoughts for physicians and patients. Enhanced access and communications with patients and electronic health records shared among medical professionals will transform healthcare in Ohio. To learn more about Ohio's health initiatives, visit www.odh.ohio.gov or www.clinisync.org.